I went to bed and I woke up in the middle of the night and I had this shortness of breath. I had difficulty breathing, and I woke up in the middle of the night thinking, God, could this be it? Is this COVID? I'm an asthmatic, so I know what that feeling's like. And I thought, oh, look, I did a rat test because we were a little bit unsure. We'd seen the statistics when we got back to Sydney, and I've lost track what it is now. But we thought, well, we only had one rat test left in the home, and we thought if anyone's going to get it, it's going to be me because of the 2-year-old. She's still breastfed and she's unvaccinated. The 9-year-old is unvaccinated, and so is the 11-year-old. They haven't been able to get an appointment. The first appointment I had for she's now 12, 12-year-old was on Monday, yesterday, and because she's a close contact, she wasn't able to get her vaccination. So I thought, look, if anyone's the weakest link, it's going to be me because of my contact with the baby. And I did the rat test and it was negative. So when I went to bed, I sort of felt, confident that, okay, well, we're fine. No one's got it. We should be right. But when I woke up in the middle of the night, I thought, oh no, I should get this. I should see if this is correct. And I woke up with a runny nose. So headed down to the drive-through COVID testing clinic and had to pass the gates. There was somebody doing a triage and saying, why are you here today and why are you going to get tested? And they thought it was legitimate enough for me to get a test that day. And I found out within 24 hours that I was positive.
How did you go about getting confirmation? Because I understand it that, as you say, your 2-year-old has COVID and also your middle daughter.
Yes. So the girls, when they and my partner all went to get tested that day that I got my notification that I was positive. Unfortunately, the 2-year-old had to go to a different place to get tested. So the Lavity Pathology Clinic that was on Hollywood Avenue is no longer available. They've closed that down. And so for parents with children under 5, you do need to go to the hospital. And thankfully the queues weren't long there, but he got it tested, and we found out actually 48 hours later that she was positive. If anyone was going to have it, it's likely to be her, being so young and I guess not understanding what social distancing it means. So she's had a cough actually for a week now, and I thought it was asthma related, but clearly, she's probably had this for some time now.
So, I mean, I imagine isolating half the family from the other half is not easy. And also, what about health advice? Have you had enough of that throughout this period? Do you have a GP that you can call on?
No, not really. Look, being a working parent, it's really hard to get a doctor in Bondi that you can see, in the next 2 to 3 days. So usually our family visits the local medical centre. We find that works for us. You don't need an appointment. You just walk in and all the doctors there are great, but we don't have a relationship with any of the doctors there. It's whoever's available on the day. And particularly with respiratory problems, that particular clinic won't see patients. So you have to use telehealth, and particularly with young children, as parents might know, if they've got respiratory problems, you always need a doctor to really have a listen to the chest and have a good look to see whether there's anything that you should worry about. So, no, we haven't been able to reach out to a doctor. And I've got to say, some of the information that's been available to us it's been quite poor. We got a photocopy from the hospital, and half the page wasn't legible because it wasn't printed properly. And there are links on websites which are great, but all of them really, if you feel exhausted, for example, if you use the symptom checker on the COVID symptom checklist, they tell you if you're feeling exhausted, then you should call 000, and it's 000, sorry. And of course, well, I would think that was a mild symptom, being exhausted. Do I really call 000 if I'm feeling exhausted? So look, we're a little bit uncertain, but look, we're just playing it by ear. Obviously, I'm keeping a close eye on the baby. As I said, she's got usually respiratory problems, and so I'm just really not sleeping very well, just making sure I can hear her breathe, and she's not having difficulty breathing. And I guess really that's all we can do in absence of sort of, I don't want to put extra pressure on the hospital system that's already overworked.
And Monica, it sounds like it's been quite a confusing experience, and that's what many have reported. Have you thought about, is there any one thing that would have made it easier?
Look, I just think, New South Wales Health did a great job at the beginning of COVID. I just felt like we're really well supported. It's clear that they are overworked and understaffed and under-resourced, and the government needs to do more to ensure that they're properly resourced, that somebody from, health actually triage families that are COVID positive. I got a survey that I had to fill out, and the survey, you could tell, was just a demographic thing. Have you been overseas? Are you of Aboriginal or Torres Strait Islander background? Why did you visit us? What made you think that you had COVID? Why did you drop in to get tested? Are you a close contact, or did you have symptoms? So I just thought, look, that's. I just would have expected more from them, particularly if we don't want to have people visit hospitals, that there would have been a more triage of COVID positive patients.